Well, that's of course tricky, and I can't really answer that using the data that we had at hand. But so there are broadly, a number of explanations, I think, that may come into play. And the first, of course, that there are biological mechanisms that's sort of like explain why certain risk factors have a greater impact on the risk of stroke in women as compared to men. And for diabetes, for example, there's evidence to suggest that it's not diabetes by itself, but that the sex differences in obesity leading to diabetes might explain why diabetes is a stronger risk factor for stroke in women as compared with men. So that's a biological explanation. There's also evidence that suggests that there are healthcare-related factors involved. So it may be that women perceive themselves as being at a lower risk of stroke as compared with men, or that physicians think that women are at a lower risk of stroke as compared to men, and that may result in differences in healthcare provision that may lead to a greater risk of stroke in women. So it may be that women aren't treated as intensively as compared with men. But at the same time, if that is the case, then you would see a greater effect of all the risk factors for stroke and not only of particular risk factors. Even though there are these differences in the healthcare provided for stroke risk factors, in the sense that women are less likely to receive certain medications. I think biological explanations are more likely to be involved, but those I think need to be further studied.